Hello, everybody. My name is Gary Baumgarten, but I expect you already know that, and I welcome you to our discussion today on Facebook Live, paltalk.com, and on YouTube. Today, there's some breaking news on the coronavirus front, and it's not very good. It's not particularly unexpected, but according to Johns Hopkins Medical Center University, they're the folks that have been doing the tracking of the coronavirus. We have now hit the unauspicious figure of 150,000 deaths in the United States. And while the mortality rate seems to be improving, going down the number of deaths per capita, the number of actual infections seems to be going up. And a guy who heads a group of folks who are actually tracking this and who have been spot on in predicting where it would spike next is my guest today. Dr. David Rubin is director of the PolicyLab at Children's Hospital of Philadelphia. Dr. Rubin, welcome to this discussion on Facebook Live, paltalk.com, and on YouTube.
Thanks for having me.
Thank you. So I was interested in reaching out to you because you have been predicting that it would hit Washington, D.C., Baltimore, Philadelphia, and the Jersey Shore, right up the mid-Atlantic, where the highest concentration of population is in the United States. And I think that was 2 weeks ago that prediction came out, and sure enough, it hit D.C. so hard that New York, New Jersey, and Connecticut have added the District of Columbia to the locations where you have to quarantine when you come in, if you come from the Washington, D.C. They just yesterday in Philadelphia announced that the scheduled September reopening of indoor dining is being delayed indefinitely. And we are seeing anecdotal evidence, including in the community I live, not far from the Jersey Shore, which you predicted, of pockets of spikes in the coronavirus, mainly because people are gathering to enjoy the weather and they are not maintaining social distancing and are not wearing face coverings. Tell me how you are actually doing this tracking.
Well, back in March and April, we started this project because when the national figures were coming out about the sheer number of deaths we might see and the number of hospitalizations, our team at CHOP had always been focused on the ways in which the experiences of working families were always influenced by where they lived. And we knew that once we decided to reopen communities, that we needed to develop forecasts that would allow, local leaders and individuals to know what was going on in their backyard, that we couldn't assume every place was going to look like New York City. And so that's resulted in forecasts that today, with our release today, we're now forecasting in nearly 750 counties across the United States. It represents all the states in the District of Columbia. And when you look at these forecasts, we can talk about how best to read these forecasts. You never want to trust any individual forecast. There's a story here that's playing out over time because we do these forecasts every week. Every week, the forecast is most influenced by the actual rate of growth in your cases that you're seeing in your county. And then we alter that 4-week forecast on the basis of the amount of social distancing we're observing using publicly available cell phone data that tracks visits to non-essential businesses like hair salons, restaurants, retail stores. We also include, how crowded your community is in terms of population density and crowded living conditions, the size of your retiree population, prevalence of health conditions, poverty in your area. And then we also adjust for your test positivity rate, which tends to climb a little bit delayed with the actual rise in cases, but tends to climb when an area is starting to surge. And then finally, we include some effects that allow each county to have their own rate of growth, that we know that some counties grow slowly and some counties grow more quickly. And so these are called the random effects for the county that are introduced into the model. And then we also include metropolitan area effects, which if a collar county of Philadelphia is growing, or all three of them, or all five of them are, then you're going to see likely growth in the Philadelphia region is the wider Philadelphia region. And so, and then finally, we have a larger regional effect as people have been traveling more in the summer. These larger climate zones seem to be converging, and we seem to be seeing widespread transmission in most places in the country, unfortunately.
Well, I know I work at Fox, and I'm considered essential. I'm one of only 5 people on the entire floor during my shift.
Mm-hmm.
And they're kind enough to spend a gazillion dollars for those of us who are going into work to Uber us in, suggesting or supposing that the chances of a transmission by riding an Uber are probably less than public transportation. There are no guarantees, of course. But when this all started, Dr. Rubin, we were flying into the city. And literally in some cases, because the cops were reticent to pull anybody over, they didn't want to have any face-to-face contact with motorists. There was no traffic. It was like the Autobahn. You could go as fast as you wanted. Now there are actually traffic jams on occasion. And I'm wondering, where are all these people going? What kind of essential service are they involved in that they have to leave their houses? And I know that they go, into stage 1, 2, 3, 4, and that varies from environment to environment. But clearly, I don't have to be a physician such as yourself, a researcher such as yourself, to recognize that common sense tells me once you start congregating in the numbers that are reflected by my anecdotal example, you're going to get spikes in the disease.
Well, I think we've learned a lot over time, and there were a lot of restrictions that were placed early on that some of which I think we overestimated the amount of risk if there were safe protocols. Like, I don't think we've seen as much transmission out of hair salons if people were both wearing masks. There was a potential outbreak in Missouri that never happened. Two hair salonists who were symptomatic with COVID cared for, I think, at least 140 clients, and none of the clients got COVID because everyone was wearing a mask. And so you don't see, when you look at some of the task force recommendations coming out, you don't see hair salons now. But there are some truths we hold to be self-evident in this COVID crisis, and one is that physical distancing is your number one intervention to mitigate transmission, and that means gathering sizes, the distance you have from people, keeping your bubbles small, wearing your mask in public locations. These things are extremely effective in mitigating transmission, and we've not developed a consistent strategy across the country with significant enforcement to ensure that we were doing these things. And so we shouldn't be surprised during a season of American travel that we've seen the kind of surges we're now seeing across most of the country.
And as you and I discussed before we went to air, we Americans pride ourselves in our independence and our right to decide for ourselves. And as a result of that, there are people who are almost militantly refusing to wear face coverings. And I find that extremely frustrating. I'm of the age where I am considered high risk. I don't want somebody to be walking up near me without a face covering. And I just think it's just poor form, if nothing else, not to wear a face covering when you come into close proximity with another human being today.
Sure. I mean, I think this issue of individual liberty, I think, is a huge component. There's a lot of fatigue out there to embracing some of these ideas. But yeah, I remember giving a talk to a local group, and I was speaking to a war veteran who happened to be a county commissioner, and he said to me during this webinar I was giving, he said, Dr. Rubin, a number of years ago, my country asked me to go to war, and they didn't give me a choice. I think that I can handle them asking me or requiring me to wear a face mask when I go into a public market. And I think,
go ahead. I'm sorry.
Part of what, from my perspective, I value the individual liberty, love this country. And I actually, I've sat down with a lot of folks, the same folks you're talking about, who are very strongly believe in not being told what to do, and who believe in limits of government intervention. That said, I do think, if we understand the American spirit around freedom and liberty, we also understand that our success as a country, sometimes our country has made sacrifices together after 9/11, after large hurricanes, to benefit our communities. And I don't think we've done enough to help people understand the individual behaviors and the needs around individual behaviors to control transmission around a shared goal. For me, it has been to open schools successfully in the fall. And lacking those clear endpoints, I think we've gotten into this fog where we're arguing about things that I think everyone could get behind if we had clear goals and we knew what we were trying to accomplish.
Well, I think part of the problem is that folks, and I'm saying this on both sides of the political spectrum, have made this a political issue, and when it should be an issue of science and of medicine. And of course, there's an evolutionary process when it comes to dealing with the COVID-19. What we thought we knew, or what you all thought you knew, was correct when this first started. As more evidence comes in, given your example of the hair salons, another example might be congregations of people outdoors as opposed to indoors. The example that I use, and I know this is totally anecdotal, and I'm not a scientist. Everybody knows I'm not a scientist, but I just want to make that clear to anybody watching or listening. I'm not making this observation from any scientific standpoint. But when the president held his first rally in Tulsa, it was indoors, and there was there were incidents of infection from among that population. His second rally was at Mount Rushmore. People were very in close proximity with one another, but it was outdoors. And I'm not saying that it's okay to be in close proximity with one another, even outdoors, but I think we learned something almost every day that we didn't know the day before. But that has caused frustration in the part of the consumer of information, because I think people get frustrated. Well, Dr. Fauci said something in March, and now he's saying something different in July. What's the real deal here? And I think it's important that people realize that every day you're getting new data, you're collecting the data, and you're learning something new.
Yeah, we're always willing to learn and to accept assumptions that didn't turn out to be true. I think the hair salons were one example of that, and and I think there's also an issue of enforcement. I think when you look at sort of the restaurant industry, and I really feel I've got a lot of friends in the restaurant industry. We know where that bars and indoor seating have been the source of transmission of violence. But we also know there have been restaurants that have been doing the right thing, and they have more to lose when there are bad actors out there that are filling up the bars that are not respecting occupancy code. And so, I actually support some limited restaurant occupancy, even in our stricter areas. Allowing restaurants to be creative, but I think we have to have stricter enforcement in terms of those people who would try to bend the rules, and that protects those people who are doing it well. And I think consumers vote with their feet. They want to go to places that are safe. And that to me, what I regret the most is that had we gotten those case counts down, if we had a little bit more patient and went a little bit more slowly, getting community transmission down to extremely low levels allows you to gain more freedoms, allows you to open up these areas sooner, and because we opened up too soon and maybe pushed through some gates, we're now back at square one, where we're having a hard time we have no margin for error for opening anymore, because we're just seeing surging rates everywhere.
And this allows us to circle back to the original premise of our discussion, and that is the data that you are releasing today, which shows that in every single state there are increases and projected increases of the COVID-19. And given the reticence that we all really have inherently to give up what we view as our freedoms, whether they are legally backed, constitutionally backed or not, how do we get people to now go back to where they were when this first started and we were all scared of this thing and there were far more of us compliant? I don't know that it's going to be so easy to put that genie back into the bottle.
Oh, I agree. I don't think there's an appetite for full quarantine, although you could argue that we'd benefit from all shutting down for 6 weeks and hitting restart, because we get back to where we want to be quicker. More pain in the short term is going to give us greater freedom later on. That's a hard concept to realize. But that said, I think we have learned a lot. And if you're watching what the task force has been doing the last couple of weeks, meaning the White House Coronavirus Task Force, what you're seeing is them trying to line up the governors in the states around some shared concepts that have borne truth. Closing the indoor bars, particularly during a season of travel, right? Limiting occupancy at restaurants, particularly in these surging areas. Reducing our gathering size, our bubbles really, really small, and adding some enforcement to that so that we can try to get a better handle of this. Maybe not approach what we got when we were quarantining in place, but allow for some economic activity. People are still working in offices. People are still distancing. We're trying to get back, and then focus our relief efforts on those industries that are being targeted. I think if we're going to do an additional package around relief, it would be to the restaurant and hospitality industry, because those are the folks that are bearing the greatest brunt of what's going on. It would not be for everyone.
And also, I know you have an affinity for that industry. I just like to point out, it's not just the owners, it's the folks that work there who in many states get way below minimum wage salaries. In my state, I think it's like, I mean, it's absurdly low in New Jersey. I think it's $2 and change, something like that. They rely on tips. They're getting zero now. They're living on the margins to begin with. We'd love to get them to go back to work. We'd love to be able to reach into our pocket and throw some greenbacks at them. And I mean, they're our friends and our neighbors, but we have to do it in a manner which is which is prudent, I guess is the word I should use.
Sure, and I think restaurants are having to adapt to some takeout. I mean, I know a lot of folks who run pizza shops. They're doing great. They were set up for quarantine, because everything was takeout to begin with. And so they're doing well. But I think some industries, some of these areas have to adapt. But I would agree that these are the people that need the focus of our attention, because we're let's face it, we're choosing between bad and worse. And we have to have that honest conversation. What is the trade-off to get us back to where we want to be, which are full restaurants and bars and feeling comfortable? And the truth is, and has always been the truth, that that people underestimated the amount of physical distancing and the amount of time we needed to degrade the cases in order to actually make this happen. We've messaged masks, I think, very well, and public opinion is changing, but sometimes we do that to the detriment of the amount of distancing that still needs to occur, as if we wear our mask, we can do whatever we want. Well, the truth is, physical distancing is still your number one intervention. It's superior to the mask, and figuring out ways to space people out, identify best practices in the restaurant industry, take advantage of the warmer weather to seat people outside in closed streets. We've seen some unique examples, and then help those folks that really have to bear out the length of this until hopefully we have a vaccine and get through this and get beyond the pandemic.
Well, I want to conclude by stating to my audience, because I've been watching this very closely on their behalf, that the PolicyLab that you had at Children's Hospital of Philadelphia has been uncannily accurate in the tracking and in the projections of what that tracking suggests for our individual environments. And I would encourage them to, I presume there's a website folks can go to where they can see your latest data. And
yeah, so our website is policylab.chop.edu. You can find our latest projections there. And I will say, one of the things that's made us able to see things is because we're doing 750 counties, whereas most of the folks who are doing models are looking at states or the country. They're at 40,000 feet. We're more at 5,000 feet, and we're doing these every week because we know there's some uncertainty. It's like a weather forecast. If you're doing them every week, you start to see the patterns emerge. If the things we like to say is, if your forecast is going up and it continues to go up and it's going up higher every week, be concerned. If your testing positivity is also going up in your region, be concerned. If the counties around you are all going up and they look the same, be concerned. And if you're seeing clear movement of this wave from south, from below you or from the side of you coming into your area, you can see that when you're doing weekly forecasts in 750 areas. And so we are able to detect these early upticks and this movement that other modelers don't see as quickly. And that's why I think we've been able to be a little bit more confident when we see, for example, spread up the Mid-Atlantic.
Well, everybody is making an individual choice about what he or she will do with regard to the COVID-19. I can't convince even members of my family to act in the manner in which I'm acting, because I believe what I'm doing is correct and they believe what they are doing is correct. But we can arm all of us with factual information that will help us determine what we ought to be doing. And that's exactly what you guys are doing. And I really want to thank you for that, Dr. David Rubin. Keep up the good work. Keep that data flowing. And folks, keep checking in.
Thanks for having me.
As I like to say at the end of our discussions, everybody stay safe and peace out.